Hello everyone. From this video, we are going to see about human papilloma virus. This is the structure of human papilloma virus. Human papilloma virus composed of capsid protein L1, histone, genomic DNA, capsid protein L2. The structure of human papilloma virus. Human papilloma virus is the most commonly sexually transmitted infection, and the structure shows small, non-enveloped icosahedral DNA viruses that have diameter of 52 to 55 nanometer. Single double-stranded DNA molecule of about 8,000 base pairs that is bound to histone protein. A protein capsid composed of 72 pentametric capsomeres. Capsid contain two structural proteins such as protein 1 and protein 2, which are both virally encoded. Classification of human papilloma virus. The International Committee on the Taxonomy of Viruses has two separate families. One is Papillomaviridae and another one is Polymaviridae. Human papilloma virus is divided into two types. There are high-risk human papilloma virus and low-risk human papilloma virus. Low risk causes warts and high risk causes lesions and cancer. Pathogenesis of human papilloma virus. Human papilloma virus infection is limited to basal cells of stratified epithelium. The virus cannot bind to live tissue. It infects epithelial tissues through epithelial trauma exposes that segments of the basement membrane. HPV virion associates with receptors such as alpha integrins, laminates, and annexin A2. Symptoms of human papilloma virus may not cause symptoms at once, but they can appear years later. Some types can lead to warts, while others can cause cancer. Common symptoms of human papilloma virus are warts, especially genital warts. It shows symptoms such as small bump, cluster of bumps. They commonly affect the vulva in women and penis or scrotum in men. They may also appear around the anus and in the groin. HPV 6 and HPV 11 are common causes of genital warts, and second one is laryngeal papillomatis. Human papilloma virus include common warts, plantar and flat warts. Common warts shows rough, raised bumps, most commonly found on the hands, finger and elbows. Plantar warts shows as odd, grainy growth on the feet. They most commonly appear on the heels or balls of the feet. Flat warts generally affect children, adolescents, and young adults. They appear as a flat topped, slightly raised lesions that are darker than normal skin color and are most commonly found on the face, neck, or areas that have been scratched. Other symptoms: anal dysplasia, precancerous condition in anal canal, genital cancers, epidermodysplasia, verruciformis that shows the Treeman syndrome, a eye skin cancer, focal epithelial hyperplasia, benign neoplastic condition in mouth, mouth papillomas, oropharyngeal cancer, laryngeal papillomatis. Transmission transmitted through intimate skin to skin contact, having vaginal, anal, or oral sex with someone who has the virus. It is most commonly spread during vaginal or anal sex. Common that nearly all men and women get it at one point in their lives. It can be passed even when an infected person has no signs or symptoms. It can develop symptoms years after being infected, making it hard to know when you first became infected. Diagnosis of human papilloma virus. Viral diagnosis such as electron microscopy, cell culture, and certain immunological methods are not suitable for human papilloma virus detection. HPV cannot be cultured in cell cultures. The important methods to diagnose human papilloma infections are colposcopy and acetic acid test, biopsy, DNA test, PCR, southern blot, hybridization, in situ hybridization are some of the diagnoses of human papilloma virus. Pap smear also used to diagnose the human papilloma infection. Treatment. Treatment of human papilloma virus. There is no specific treatment for HPV infection. However, what can be treated? Salicylic acid. Used over-the-counter treatment that contains salicylic acid work by removing layers of a wart a little at a time. Imiquimod enhance your immune system's ability to fight HPV. Common side effects include redness and swelling at the application site. Podophylox works by destroying genital wart tissue. Podophylax may cause pain and itching where it's applied. Trichloroacetic acid. This chemical treatment burns off warts on the palms, soles and genitals. It might cause local irritation. Other treatments: freezing with liquid nitrogen, burning with an electrical current, surgical removal, and laser surgery. Freezing with liquid nitrogen is said to be a cryotherapy, and burning with an electrical current is said to be the electrocautery. Vaccine. Vaccination used for human papilloma viruses are Cardazel and Cervarix. Cardazel is used HPV 16 and HPV 18 that's associated with 70% of cervical cancers, 90% of anal cancer and many cancers that can affect your throat and genitals. HPV 6 and HPV 11 associated with 90% of genital warts. Cervarix. It protects against infections associated with HPV 16 and HPV 18. Prevention. Vaccination. Avoid skin to skin contact by not having sex with strangers. Use condoms. Safer sex can lower your chances and getting HPV. Thank you for your patience listening.